Welcome back to Frank Assessment, where underwriting is everything. I'm your host for the program, Tim Moynihan, and I am delighted to welcome our initial guest, our Vice President and Sales Advisor at BSMG, Mike Hopkins. Mike, welcome to Frank Assessment, buddy.
Thanks for having me. Appreciate it. It's great to be here.
We're glad to have you. What's on your mind, buddy?
Well, I was hoping we could talk a little about prostate cancer. I've had a lot of cases lately. It can be a really tough issue. Can you tell me what you're looking for when you see a prostate cancer case?
Mike, we're looking for a few things. First and foremost, we're looking for the age of diagnosis, 50s and older. We're looking at the Gleason score, Mike, the grade of the prostatic lesion. The watershed number is 6. 6 or less is good. Looking for the stage, Mike. Love to see that stage be a 1, a stage 1 or better, and in situ lesion. Stage 2s are in play, Mike, but I'm looking for dead on stage 1s. Mike, also looking for ongoing urological care and a participatory patient. That ongoing care with quality urological follow-up is key.
So if we have a patient that's doing his follow-up, has great care, and has all the correct numbers and everything, what kind of rating are we looking at?
Standard.
Really?
All day long.
Okay.
All day long.
So I know we've had some tough cases here lately. We had one that I'm thinking of in particular where the client had a 36 PSA, had been declined at some places, postponed obviously, and you ended up with a standard offer on that case. How did you get there?
Great case, Mike. Super case. This is a really, really cool one. Active surveillance prostate cancer case. You don't remove the prostate. The urologist actively monitors the prostate lesion because it's so slow growing. In this instance, his most recent biopsy, which was about 7 months ago, showed stable, ongoing urological care. The tumor wasn't growing, but his post-biopsy PSA was 36.2. Of course, a 36.2 is not 4 or better, and carriers, red flags go up. We don't want to see the case, want to see the PSA come down, want to see 2 years of stability, declines across the board. But when we engaged the oncological urologist at Sloan Kettering, Memorial Sloan Kettering, doesn't get any better than that, basically understood that 36.2 was not tied to the cancer, it was tied to the trauma done to the gland, which rises the amount of prostatic cells in the blood, and you end up with a 36.2. 2 months later, the PSA comes back down to 2. We actually present the amplified information from Sloan Kettering, and we delivered standard.
That's amazing, an amazing offer. I had another case that I was involved with where we had a client who had prostate cancer twice, which is almost always a decline. And you did something I don't think I normally see in this industry, which is you actually reached out to the doctor. And we ended up with a standard from 6 carriers on this offer. Can you tell me a little bit about what you did on this case?
Unbelievable engagement, and you did a lot of great stuff on this, Mike, as well. So this is a 71-year-old gentleman, original prostate cancer with a prostatectomy 2 years ago. 18 months ago, he had a recurrence. However, that recurrence was located in the prostatic bed that held the actual prostatic gland before it was removed 10 years ago. It was a tissue remnant. But of course, recurrent prostate cancer and recent, everyone declines. Fortunately, this patient was being seen by the chief of oncological urology at Johns Hopkins. We had an audience with him. He provided us with an academic letter amplifying the unique nature of this recurrence and the treatment, which was radiation, salvage radiation therapy. Mike, 6 carriers with this amplified data went standard, and we placed $55 million of coverage. A great win, and a really, really cool case.
It was a cool case. And I've seen you do this over and over time. How do you do this? How do you take cases from the trash can to standard?
Mike, the magic is risk differentiation underwriting. And if anybody listening today wants to learn more about RDU, you need to call us. And before we go, don't forget, join us for the next segment of Frank Assessment, where underwriting is everything.